And the next, we have PNSG, Peel Newcomer Strategy Group, and those of you who are outside of Peel, this is our wonderful partnership, a series of projects that we have, and I'm going to let Rodell and Essel, both of them to come, introduce themselves and talk about how in Peel we work together to provide services to newcomers and what are some of the innovative projects and what we have achieved to date. And please, Rodell, please come on the stage. And the presentation is ready and queued in.
Good morning, everyone, and welcome to Peel region if you're from outside of the region. Just by show of hands, may I ask who here does not live or work in Caledon, Brampton, or Mississauga? If you can just raise your hands. Perfect. Thank you. That's relevant for what I'm going to present this morning, to give you a little bit of demographic background about our particular region. I first want to start off by saying thank you to Baldev and the PCHS team for putting on this particular event and inviting us to come and speak and contribute to it, and also for the support from IRCC as well. Also to Dr. Tiagi, it's almost as if you saw the presentation that was to follow, and I appreciate not only your particular work, but also everyone here who is contributing in a frontline capacity. I am not in a frontline capacity. I'm going to tell you about the local immigration partnership here in Peel region, but I am married to a clinical social worker who has worked in Peel region, and now we live in Simcoe County. And I think spouses and partners of those who are engaged on the front line are uniquely positioned to appreciate the work that you're engaged in. So by way of this morning's presentation, I'm not entirely sure whether it'll take the entire time or perhaps that'll leave more time for questions. I will tell you about the role of the local immigration partnership and how settlement dovetails into different aspects of the Peel community. And then I'll ask my colleague Essel to talk about some of the specific initiatives where we have been working with mental health and children's aid, to give you a sense of what's happening on the ground if you weren't already aware, or if you're coming from outside of the region. So to give you a sense of where we are located, for those of you who come from outside of Peel region, this is the metropolitan Toronto area, and Peel region is that particular area there. It's comprised of Caledon, Mississauga, and Brampton. What's notable about that is that it comprises two large cities. Mississauga is the 6th largest municipality in the country, and Brampton, I believe, is the 9th largest. And the further north you press into Caledon region, it becomes more rural. It encompasses a population of 1.38 million people. And from our partners at Peel Data Center, we have some conflicting numbers as to how many new residents we welcome from Peel region, whether on a permanent or temporary or combined type of basis. But generally, there's agreement that more than 17,000 new residents were welcomed in 2015, the latest year for which we have data. And of these, 12,990 were permanent migrants, economic class, family class, refugees, and other. What's interesting about this is that we are an immigrant majority population. 51.5% were born outside of Canada. I'm not sure whether you can see the numbers clearly enough against that green. It's from our colleagues at the Regional Municipality of York Region, who put the 51.5% immigrant proportion of the population into some context compared to the greater metropolitan Toronto region. It actually outstrips the City of Toronto and the Regional Municipality of York. And as you press farther out west and east on both sides, that proportion tends to go down. But that gives you a bit of a story of the volume of immigrants who are residing here in Caledon, Brampton, and in Mississauga. You're probably not able to see this very closely. The top 5 countries from which we receive our newcomers to Peel region, India, Pakistan, and the Philippines, figure prominently across all 3 communities. And really, as Dr. Tyagi had mentioned previously, a big part of the narrative of immigration and newcomers settling in Peel region is really the story of South Asians coming to our communities. How does Peel region compare to other municipalities when we're talking about newcomers? So if you're looking at the number of newcomers to Canada who arrived between 2011 and 2016, that's how we define newcomer. Not all of them are coming to Peel region, about a quarter are. About 50% are settling in the 416 in City of Toronto proper. And then we are the second largest recipient of newcomers based on that metropolitan area. We receive about half as many between 2011 and 2016 compared to Toronto. And then our colleagues in York region, north of the city, receive about a bit more than half as much as we do in Peel region. So that gives you a sense of the demographics. So if you're coming from outside of Peel region, that gives you a sense of the context within which many of us in the community are working. As I mentioned, immigrant majority, we're a large landing destination for newcomers to Canada. A bit about what a LIP is, and Dr. Tyagi also mentioned that towards the end. We are the LIP. The LIP stands for Local Immigration Partnership, and it's a unique type of community collaborative. There are 77 LIPs operating across Canada. So, when you go back to your own communities after the conference, you may want to find out who your local immigration partnership is and who those coordinators are, and perhaps connect with them. And some of the benefits of that, I'm sure that Essel, my colleague, will talk about that in a few minutes' time. If I was to describe what the work of the LIP, perhaps in very defined terms, perhaps in almost cold terms, it's really about optimizing the settlement experience. But immigration, settlement, newcomer integration, we're talking about human dynamics. And so the warmer type of definition of that is, how do we make Peel region more welcoming for newcomers to Canada? How do we create collaboration within the systems that exist within our communities so that we can accelerate that sense of belonging, and so that newcomers are thriving? We know that newcomers to Canada face barriers. Those barriers are perhaps rather unique in a region like Peel, where there is a tremendous volume. I attended the first national LIP conference in Calgary last week, and that was followed by Metropolis, the Immigration Research and Policy National Conference. And I know that a lot of communities across Ontario, as well as across the country, look at Peel region with some envy. They're struggling, trying to replenish their population, because many of their young people are choosing to move to urban centers and away from their rural or smaller towns and municipalities. And for us in Peel, we have different types of challenges and opportunities. And potentially that there are opportunities to work together across those communities. But suffice to say that, the work of the Local Immigration Partnership, we do a lot of work in convening different stakeholders across the region. And it's not just about settlement. We also convene non-settlement actors and organizations and professionals as well. So we've received guidance from the federal government about the 17 aspects of a welcoming community, and not all 17 of those aspects are related to the services provided by a settlement organization. It encompasses things like creating a sense of belonging, interfacing with community services. There are very specific things regarding religion interfacing with police and the justice system, for example. And obviously, mental health, health care, children's protection, these all factor in, especially when you describe Peel region as having a large volume of immigrants. And so a lot of the research and statistics that Dr. Tyagi had mentioned in her presentation previously are extremely relevant in a location like Peel region that receives quite a number of newcomers. As I mentioned, we're a community collaborative of organizations with a stake in the successful integration of newcomers into Peel region. We're funded by IRCC with incremental support from the regional government level as well as the United Way of Peel region, and that we convene a number of standing committees and we conduct research and strategic planning. What it boils down to, as I said, we're about creating a more welcoming community, creating systems of collaboration that make it possible for newcomers to Canada to have a more seamless service experience when they interface with our service infrastructure in Peel region. And some of the standing committees that we happen to convene is a central planning table. It almost serves as a board of directors type of structure that informs us from different parts of the community what their settlement experience is all about, and it informs our particular planning. Perhaps our most relevant standing committee with respect to this particular conference is our SDN, our Service Delivery Network. And it's a combination of 5 neighborhood community agencies, including PCHS, who helped to create the sort of social capital ties among the agencies that enable collaboration on different types of projects. And these are the types of emergent type of systems that we would then like to expand outwardly to include other community agencies. And a lot of that work is not just focused in a closed network sort of way among those 5 agencies. It actually expands outward to include partners like Peel Children's Aid, Peel CAS. So with that, I'm going to pass it now to Essa, who will talk to you a bit more about some of our partnerships, projects, and initiatives with Peel CAS and some of our SDN partners.
Thank you, Rodel. Good morning and hello, everyone. My name is Asal Panlaki. I'm delighted to be here today, and thanks Punjabi Community Health Services for having us here. So I'm also with Peel Newcomer Strategy Group. I'm the service integration specialist, and the focus of my work there is to provide support to one of PNSG's working group, which is the Service Delivery Network, or SDN. So SDN was established in 2012. The group meets once a month, and the focus is on service coordination and integration, data gathering, and improving access in navigating services. We at SDN believe that to ensure that newcomers, immigrants, and refugees have access to the right service at the right time to address their specific needs, we need to improve integration and coordination between services, and that this can only be achieved through effective partnerships. So these 5 agencies have been leading the work in each of the neighborhood identified in the PNSG study as underserved neighborhoods to improve access to services and address newcomer needs. PNSG's role, as Rodel mentioned earlier, within this partnership is to act as the backbone for these agencies and forge collaborative relationships between those in and outside of the sector. The achievements of the SDN for the past years are in the areas of community hub initiatives, the research studies done in each of the 5 neighborhoods, which help us identify the needs of the residents and the newcomers, the partnership we had with the Peel Data Center on the development of the online newcomer profile tool, which shares newcomer-specific data and an interactive map of the assets in the Peel region and the SDN Peel CAS pilot project. And I'll be talking about this. This partnership started in 2015 with the influx of Syrian refugees in Peel. We started to have conversation at the SDN table on how we can do things differently and creatively to address the needs of these newcomer refugee families. We had lots of discussions around how we can strengthen and expand our partnership. We started to look beyond the settlement sector and strategize on how we can engage mainstream organizations in a more meaningful way. Now, we heard about this great partnership happening in London, Ontario, between the Children Aid Society and the Muslim Resource Center. The intent of this partnership then is not only to reduce the rate of Muslim children in CAS care, but also to address cultural misunderstandings and preconceived notions that could affect the handling of CAS cases. Respected leaders and members of the Muslim community and the families involved were engaged in a meaningful way through the handling of CAS cases. Their partnership also developed protocols to handle cases in the most sensitive and the most effective way. And after just a few years of working together in the community, the rate of Muslim children in CAS care in London have been reduced. In the case of Peel, we don't have high rate of children in Peel CAS care. However, in 2016, the Peel CAS immigration team reached out to us to explore the idea of working together to better support the Syrian newcomer families. We had a very great and productive conversation, so we decided to start a pilot project. So the focus of the pilot project is around adapting a preventive and proactive approach in terms of the timely identification of needs and subsequent provision of help so that problems of newcomer Syrian families do not become entrenched. The aim is to develop a collaborative response to better serve the Syrian families in a proactive approach. So the pilot has two components. The first one is providing educational sessions at the Refugee Assistance Program, or the RAP Center, where one of our SDN member agency, the Polycultural Community Immigrant Services, is the lead agency. So Peel CAS staff and some of the frontline staff from Polycultural and Peel Multicultural Council also were present when the sessions are being held to provide us interpretation and support to the Syrian newcomer families. So the second component of the pilot project is the joint training between PNSG's SDN agencies and Peel CAS to build awareness of the work of each sector and to develop collaborative ways to support families. The training was held in March of 2016 and was attended by 30 frontline staff from the settlement sector and Peel CAS. The training was collectively planned and implemented not only by the SDN member agencies, but also by the frontline staff that we recruited from Peel CAS, PMC, Polycultural, and Punjabi Community Health Services. They were all directly working with Syrian newcomer families. They helped in planning for the training, gathering training materials, developing the training curriculum and evaluation forms, and writing case scenarios for the training. So in terms of the feedback that we received from the participants, we were happy that majority of them thought that the training will make a difference in the way they do their job, especially in terms of providing better support to Syrian newcomer families. So those were just some of the feedback that we got from the training participants. Now, based on the success of our pilot project, PNSG, SDN, and Peel CAS agreed to continue to work together. We decided to expand the pilot training held in March 2016 to include child welfare, settlement, and VAW sector. The training was held last week on March 22nd. Again, it was a very successful training with 85 frontline workers and managers representing a total of 36 settlement and mainstream agencies attended the training. Another good thing about this training is that we got some funding from NCI to hire a consultant to evaluate its impact. We administered pre- and post-training evaluation forms, which was developed by the consultant with the help of the project team. We are now in the process of tabulating the results, and the consultant will analyze the data and will write a report, including recommendations on how we can improve the training and to inform the work that we'll be doing moving forward. Now, that training, the overall goal is not only to support newcomer families overcome the challenges they face towards navigating the system by building the capacity of service providers that serve these clients. The specific objectives include to increase knowledge of settlement crisis workers and PCHS staff on the work that each sector has been doing for refugees, newcomers, and immigrants, including their roles and mandates. And also to educate and improve awareness and skills of settlement crisis workers and PCHS staff in understanding gender-based violence from an intersectional lens. So recently, we also started another innovative initiative, which is the Joint Home Visit Project, involving PCHS and settlement agencies, the Peel Multicultural Council, the Polycultural Immigrant and Community Services, and the Punjabi Community Health Services. Some of the outcomes of the Joint Visit Project are the following: ensure safety, protection, and well-being of the families involved. Refugees, newcomers are helped to deal with the settlement and integration issues as they emerge. Families will be connected with the right services that fit their situation the best at the right time. Families will become more familiar with the services and supports available to their families. Service providers will identify any potential gaps in service to seamless service through knowledge sharing among stakeholders and the incorporation of both informal and formal supports. And also, agencies will become proactive and will focus on prevention and address settlement stressors. So the deliverables for this project include the development of referral protocols and pathway, which we already completed, the home visit training, which was held on December 19th of last year, and the development of service model that includes opportunities for consultation, joint assessment, including a joint visiting component. We will also be doing evaluation for this project. We got some funding from IRCC to hire a consultant who will be doing key informant interviews with the executive directors of agencies involved, and also interviewing some families that we visited. The consultant will also hold a focus group discussion very soon with managers and staff from the settlement agencies and PCHS. The consultant will also be analyzing the data and will create a report based on her analysis. The SDN members are member agencies and the frontline staff involved in the joint home visit project are also scheduled to do some debriefing session to discuss challenges and lessons learned, so we can plan effectively on next steps on how to improve our work in the community. Thank you.
My question is to Rodel.
Yeah.
My question might be more political or maybe for the higher level, but I will ask it anyway. So you mentioned that 51% of Peel region are foreign-born, which means immigrant.
Yes.
So I wonder what is the impact does that have on the Peel region? Like too many people coming every year. Is there any enough jobs, houses, many things available for them? And as settlement agencies or as people working with immigrants, how can we redirect people to go to another places like Waterloo region, counties, other places? So, thank you.
Yeah, that is a political question. Thank you. You know, I participate on a lot of different consultation tables where stakeholders from whether they are here in Peel Region or outside of Peel talk about their particular experience. So, you know, I guess the political answer to that is that I can't fully account for all of that, those perspectives. It's not my position to talk about, you know, whether we receive too many. What we do know is that we receive a lot. And a lot of newcomers require services of all kinds, that there are barriers for those newcomers to access those services, or that there are fragmented experiences in trying to connect from one service provider to another, to another, to another. And so, you know, our work is about knitting together and creating connective tissue between them. A lot of work recently has been around creating more effective referrals between agencies and service providers that don't traditionally or have not in the past traditionally worked together. So I'll give you an example with respect to the recent influx of Syrian refugees. So the region of Peel had convened a working group, a cross-stakeholder working group to create systems of collaboration for an effective refugee resettlement effort in Peel region. And when we started receiving Syrian families, we noticed that there were a lot of referrals that were looking to be made between education, so Peel District School Board, for example, to Peel-based children and youth mental health agencies. And so, you know, there were already systems of collaboration, but by having everyone in that effort sitting at the same table, sharing information, describing what is happening on the ground as it is happening, it makes it much more easy for all of those actors around the table to say, I will do this, you can do that. And so we then create very quick and immediate responses to immediate needs. To your question around regionality in terms of trying to push different newcomers to different communities, that's a persistent issue. You know, we understand the need to belong, and you know, the need to belong is very strong when your cultural or ethnocultural group or your religious group, you know, is within a particular type of community. In speaking with, for example, you know, an MCI, Ministry of Citizenship and Immigration, Ontario representative, she met 2 Syrian refugees during her vacation to Prince Edward Island in Eastern Canada. And the 2 of them were talking about wanting to move to Mississauga, right? And so, you know, what we find in that resettlement effort, you know, we have a high concentration of Syrian refugee families, you know, drawn like a magnet to the Square One neighborhood. And we hear about, you know, spaces for link classes in other communities across, you know, in Brampton, in Caledon. And so trying to promote the opportunity to, you know, so that newcomers are able to access services. You know, we're part of that effort, and we're part of that effort with our community partners. If you were to take a slightly larger lens outside of Peel region, you know, our colleagues in Wellington County, in Quinte, and you know, to the east, in Eastern Ontario, they want to know, you know, how can we promote our community so that we can absorb those who are facing, let's say, higher housing costs in Peel region and in the Toronto region, and try to attract, you know, newcomers there. And so, you know, there are some emergent conversations around secondary migration, things like that. These would not be possible without opening those types of, you know, open and transparent collaborative types of conversations. And so these tend to happen at a lot of different levels. PNSG, Peel Newcomer Strategy Group, we represent, you know, the systems that operate in Caledon, Brampton, and Mississauga, but we know that the lived reality involves, you know, many more, you know, regions and stakeholders and categories, and we try as much as possible to be inclusive of that so that we don't miss opportunities to accelerate someone's integration into the local community, wherever that local community might be. Does that answer your question? Okay.
So
Oh, sorry. Go. Oh, sorry. There. Whoever has the mic, and then we'll go there.
So mine is more a comment and less of a question or a request, maybe, since we have IRCC here. Essel, you mentioned a bit about the SDN and the home visit protocol that you're launching with PCHS, and I was one of the frontline staff workers that was in both the trainings of the joint PCHS one and the pre-launch of the pilot project for the home visits. But after attending that visit, we were told because we are IRCC funded staff, we won't be actually doing those home visits, and there are other staff who will be doing that. And this is where the request or comment comes in, is that it would be, in my opinion, beneficial for our IRCC to reconsider the crisis counselor positions to be able to conduct those home visits in this pilot project, because that, I believe, is the core of our work and what we do, because there are crisis situations where we need to be really front line, and we can't wait for people to come to us. Again, it brings me back to the comment or the question I had for the keynote speaker, is that we need to be where the clients are. And one of my colleagues came back from a joint visit with PCHS yesterday, where police were involved and there was a real crisis situation. And all she was thinking was, why is it me here and not the crisis counselor? Not that she's not able to handle it, but it is the core of our work, and that's what we should be doing and following up with our clients after. So it's just food for thought. Thank you.
Can I say something about that? Thank you for sharing and for providing comment. So, as I mentioned, this is a pilot project. Our partnership is very new in terms of doing this work, and we are also in the process of learning. In fact, yesterday we had at the SDN meeting, we invited some of the frontline staff doing the joint visit to provide us share their experiences in doing so. And again, as I mentioned, it's not perfect. We're learning. We have documented some of the suggestions, and your comment has been you have the same sentiments with the other frontline staff who were there, and we will definitely record that and document that and forward it to IRCC. Thank you.
This is just a comment because people are asking. I'm from Durham region, and it's the smallest percentage of newcomer. But right now, Durham is the fastest growing community. I'm not saying come, let your newcomers come to our region, but we would love that. We have 2 welcome center, and I live in Durham region. I came from Toronto, and Durham region is such a beautiful, it's a big geographical area. There's a lot of space, a lot of housing. The region is trying to get in more employment, factories. It's growing as a region. You might think, oh, that's so far, but it's a growing community. My comment is, I hope one day you could also come in Durham region and not wait till there's a booming newcomers. We have Syrian families. We have a lot of support for our Syrian families. It's not as much as what you're receiving, and there's a lot of communities helping the Syrian families. So I think it's great that we were able to come here and see other region, how are they doing, what their programs and services is. But it would be nice if you can connect also with us and not wait till we're like 50% newcomers in our population. Thank you very much.
Thank you. And by the way, Audrey Andrews in Durham region is your representative for the local immigration partnership if you need to work with her. Okay.
Hi, my name is Jalil. I'm from Halton Catholic District School Board. I have a question, actually, maybe this can be directed to Randall and also for Mr. Roy from IRCC. Actually, part of my previous experience, I was a RAB settlement worker in Newfoundland, St. John's, and I was working with the LIP program over there for a few years. There's just kind of a note, actually, I have noticed it in Newfoundland, maybe it's already here in Ontario. It's about the, maybe I could call it the inconsistency between some kind of federal regulations. Like, for example, some of our clients facing problems with the financial issues. Like, for example, for their children, when they have a child is age or reached the age 18-year-old, the child benefit will be cut because of his age. However, on the other side, the IRCC doesn't pay for that child as an adult, an extra pay. So these period of I would say 1 year period, that child by the revenue agency is considered adult, but for the IRCC considered they would call it a junior. So he's not receiving any extra money. And some of them actually who suffer from, I would say, mental illness or disabilities who cannot, for example, work. So those add actually extra, what do you call it, stress for the family. That they have, for example, a grown-up child, but he doesn't receive any kind of financial support. Actually, this issue has been brought from Newfoundland, but I'm wondering, is there any solution to solve that issue here in Ontario? Because actually, after I moved from Newfoundland to Ontario, I still received some calls from my clients in Newfoundland to move here to Ontario if the financial situation is better. Mm-hmm. So I'm wondering how you guys can answer this question.
I have not encountered that specific type of inquiry yet at any of our collaboration tables, to be perfectly honest. However, this is I appreciate that description because that is exactly the type of conversation that tends to happen at a local immigration partnership level. So I appreciate the fact that you have a LIP background as well in that. And you know, a lot of the conversations that I've been privy to more recently has not been on that particular issue. I'll give you an example. You know, we've heard from some of our colleagues working frontline with Syrian refugee families that many of them can't access or afford local transit until you know, the baby bonus starts kicking in, you know, a couple weeks and months down the road type of thing. And attending the Metropolis conference last week, we hear about what our colleagues are facing in the city of Calgary, that for low-income families, including refugees, they have a potential solution. They've introduced, for example, a transit pass for only $5 a month. You know, and so we are learning about best practices that are happening across the country that could be promoted, replicated in other parts. Yes, there is fragmentation in the system. I can't specifically speak to the one that you have brought up, and I apologize for that. I've not been privy to those types of conversations, but I do acknowledge that these are the types of gaps and experiences and perspectives that drive a lot of the collaboration tables that happen at the local immigration partnership level. Yeah? Okay.
Okay. Just continuing with what you end with the local immigration partnership work, the reason we have local immigration partnership is to ease with the integration and retaining the newcomers in the province. And I see one of the challenges that facing, like most of the newcomers, and this came very popular and very strong after the arrival of the Syrian refugee. Sorry, I have called, sorry. And because most of the children are not educated and they have been away from school for a while, and this adds to their mental health issues and increase all of the things that I'm not going to repeat what everybody knows. But because one of the work of the BSNG and the LIP is to having or building some of integrating and bridging programs. And for the kids now, what is happening is that they found themselves in a school where they have been away for many years, and suddenly they are in grade 11 or 12, and we end up having the kids having issues at the school. So is there any ideas or any plan for some kind of bridging program for the Syrian refugee or any other refugees in general, or any person who is coming to Canada and missing educational background,
And also, this is one question, also part of integration and bridging program is for work. There are some people who want to work, but we know that there is a big gap in the language, there is a big gap in education. Everybody knows about this, but is there any plan for future integration or bridging program in the city, or call for proposals that we can apply for? So just a question.
Okay. Are you based in Peel region? Yep. You probably want to connect with Sue Zadler at Access Employment or Paula Calderon at Access Employment. They have a number of bridging programs that are focused on Syrian newcomers. What we have heard in some of the evaluations and reporting that we've been privy to around those who have settled in Peel region, absolutely. You know, what is there for children and youth who have not been in formal education for some time and suddenly find themselves here, and then suddenly they're, you know, in a PDSB school, for example. That has been identified as challenges. Some of the community response has been around social integration measures. So within, you know, the first year, the city of Mississauga, for example, has sponsored opportunities, you know, to connect with local community centers and the like, so that they are participating in the community. But one aspect that was noted among our refugee resettlement working group is acknowledgement that a lot of the service design is tilted towards adults and grown-ups and not necessarily for children and youth. So that is a potential area that, you know, we need to take, you know, a closer look at to see what we can do for those individuals, especially, you know, if, you know, they are entering into an educational system and one, it's foreign, two, they've not been in a formal education system by and large for some time. So no answers there with respect to actual hard solutions to that. We are capping off an evaluation and a report on the community response thus far. And so what we have done is surface those particular issues. It has certainly been identified by frontline service providers across a number of different service categories. And it will be the work moving forward to try to identify ways in order to address that. But just going back to the employment piece, there are employment supports also being provided by settlement agencies as well. But if you're looking for bridging programs, certainly Access Employment in Brampton and at the Square One location is probably your best bet to connect with.